The smiles are big, bright, and now visible along the Champs-Élysées. France has lifted most of its COVID-19 public safety measures like vaccine passports and masking in most circumstances. Many in Paris enjoying the start to this week. She says it's true that it's more pleasant to not wear a mask, especially when working, to be able to see people's smiles. The only mask enforcement in France is on public transport and in health facilities. While the situation in hospitals is improving, case counts are starting to increase. It has one Canadian infectious disease specialist saying lawmakers need to use targeted public health restrictions if they're considering bringing them back.
And so it's not insensitive as much as it's pragmatic to start thinking about the future where we don't go backwards. It's also very confusing for people to keep going backwards with policymaking.
Dr. Neil Rao says the country has reached a point where it's time for Canadians to start living with COVID-19. He notes the next 45 days will be important to reduce the risks of spreading a new variant.
It's time to start living with COVID. It doesn't mean we're cavalier and that we ignore the vulnerable people who can get the worst outcomes from it. We still need to be careful in healthcare. We need to be careful with immunocompromised patients.
In China, that time is now, as the country deals with increased caseloads of stealth Omicron, a variant which has brought the country's largest outbreaks since the discovery of COVID-19 in Wuhan. This woman in Shanghai says, "I think the pandemic this year is worse than the first year, but we aren't really panicking, unlike the first year where everyone was panicking. Now, no one is panicking and their attention to self-protection is quite good." Shanghai has shut down schools and parks, but in the hardest hit province in northeastern China, some 26 million residents have been forbidden from leaving their homes. Kyle Benning, Global News.